Hey guys, wanted to sit down tonight and actually do something I've been putting off for quite a while, and that's actually make a video of one of the medical kits that I carry with me anytime I go into the woods, whether that be hunting, camping, hiking, whatever. This is the kit that I always take with me when I go into the woods. Real quick, this is my first YouTube video, so I apologize for the jumping camera. It's the only setup I've got right now, and I'm sure I'm going to make a few mistakes, so if you could overlook those, I would greatly appreciate it. And second disclaimer real quick, I am not giving anybody medical advice. I am not a doctor, combat medic, nurse, etc. I do have medical training and some medical knowledge. I do work at a hospital. But this kit was built off of my experiences with accidents throughout my life, and also too, I wanted to build a kit that could treat cuts, abrasions, lacerations, on up to your more traumatic injuries such as a gunshot wound. Excuse me. So that was the idea that I had when I was trying to create this particular system. So this is the kit that I've carried with me for a while, and it's got many miles on it, and I've used it in several different situations throughout my time, actually mostly hiking. When I find myself 2 days away from the closest town, this really gives me a lot of peace of mind to know that if something really bad was to happen, in the form of a medical emergency, I've got something that could possibly sustain my life or the life of a friend, a family, or maybe even a complete stranger. With that, we'll get right into it. This is actually this kit. Let me tell you this. This kit is the Condor EMT Tearaway Pouch. Now there's a lot of other different types of tearaway pouches, but for the different compartments that's inside of this thing, this was going to work best for what I wanted to do. And on top, the price at I believe it was $26. Very reasonable, very reasonably priced. So, but for those of you that are just now learning about this stuff, I'll explain when they say EMT Tearaway Pouch. This is the actual panel that mollies onto a bag or a vest of some sort, which basically allows the panel to stay where it is, and it's held in place by Velcro. I always take my EMT shears and basically just put them on the inside of that, and this particular system seems to do really well, and it always keeps them there. But basically, when you depress that, pop that buckle, and you grab this handle right here and pull, the whole medical kit goes with you. For a lot of military or law enforcement, this particular setup works very well. Now, this in comparison, let me show you another one so that you can actually see in comparison of size. This is a SOE EMT Tearaway Pouch. A lot more expensive, but of course a lot better quality. However, it does not have the different compartments like this one does, and so that's the reason why I chose to go with this one. This one, however, is more set up for gunshot wounds. This one pretty much stays on. I've got a Brocos battle belt that this attaches to the back side of it, and this is the one that I always usually take with me to the range, as well as also have a trauma bag that usually stays in my car at all times, actually. So again, this one has this very specific purpose and setup, but the reason I wanted to show you this one, as size-wise, they are very similar in size. However, you can see how much more packed that I have this one in comparison to this one. So anyway, we'll start with the first item that we actually come to, which is my combat tourniquet. Now, this paneling was actually came with it, and if I'm not mistaken, I'm not 100% sure, but this is comes from SNS Precision. This is one of the most expensive items that I have in my medical kit. This particular tourniquet is one of the highest quality tourniquets that I have ever had in my possession. This particular tourniquet, and I have a lot of friends that are combat medics, and I listen when they're telling me things or if they're trying to teach me things. And one of the things they always point out is one of the flaws with the cat tourniquets, and I'll show you the one that I'm actually referring to here. This is your standard cat or combat tourniquet that you'll find in most IFAKs, military IFAKs at least. These run for about, if you buy them retail, they're about $30 a piece. One of the problems that these combat medics always talk about, and military personnel, is in a stressful situation. You've got so much adrenaline pumping. If you're trying to save the life of your buddy or your own life, you apply this tourniquet and you use this device here to cinch this thing down. This thing is made out of a plastic and it's very hard. However, sometimes under the stress, these things will snap in two, which basically renders this thing almost useless. It does have a strap here that you could put something else inside of it. However, to keep this in place, this thing has a very specific device here which keeps that tourniquet in place once it's been cinched down. So this one here actually has rubber paneling sewn all the way around the inside of this tourniquet, as well as around the band that goes around the limb. So no matter if it's sweat, water, blood, this helps keep this tourniquet in place as it's being applied. Also too, your cinching device here on the front, this piece right here, is actually made out of aircraft aluminum, okay? And you can see the actual webbing here is much larger. This is made out of more of a silk component, where this is nylon, okay? So the likelihood of this breaking is almost impossible. Even though I paid a lot more money for this tourniquet than this, you know, the peace of mind that I have, if I'm only going to have one tourniquet with me at all times, I want it to be the best. That's the combat tourniquet I have. On the outside, I always carry a small roll of duct tape. Has a million and one reasons. I don't need to go into that. I always have some type of additional light source. I like these glow sticks. They're easy to administer, and gives me at least some source if my primary lighting system. And now you have to keep in mind, this is in conjunction with what I would normally carry with me in the woods, and which is going to be some type of headlamp device, or I'll at least have this is my everyday carry lighting system. So again, this is in conjunction with one of these items that I'll always have with me at that time. So again, I talked about the shears. Let's go ahead and open this thing up. This thing breaks out into 3 separate compartments, and I'll go through each one of them with you. Okay, I'm going to flip this thing around this way, and we'll start here and work our way back. In any type of trauma kit, this is an absolute must. This is your chest seal for sucking chest wounds. I pretty much any trauma kit that I have, this goes in it. Now, there are different ways that you can make makeshift chest seals. However, if I'm the one that is suffering from a sucking chest wound and I have the strength in me to open this kit up and get this thing out, I don't want to be having to fool with cutting a piece of film or taping it to myself. I want one object that I can deploy that's ready, that's here, open it up, apply it, and I'm done. And I can either go call for help, administer this to another individual. One of the reasons that I specifically carry this in this kit, now again, this kit goes with me if I'm going camping, hiking, hunting. Last year we had 4 reported and confirmed cases of accidental shootings here during hunting season. A lot of people, I don't think, realize or contemplate, what kind of caliber of round that we use when we go hunting, whether it's a 270, a 30-30, a 30-06, a 308. These are calibers that are made to do massive amounts of damage, and so, if you get hit in a particular area, anywhere in your chest, there's a good possibility that you're going to need this apparatus right here. This device right here could save your life. So chest seal is an absolute must. Here we have the pharyngeal device, which is basically, I call it the J-hook. This is administered if you perhaps maybe you've got a family member that has went unconscious. This will help keep that airway open. What happens is if you leave an individual laying on their back, they are unconscious, whether it be from a head trauma or other type of medical issue. This will keep that tongue depressed. The tongue will fall back and block the airway. Maybe the individual happens to go into cardiac arrest. This will help keep the airways or allow you to perform CPR. You can see these channels right here. This helps keep that tongue depressed down, keep the airways open. Okay, this fits right inside the roof of the mouth, and of course this allows the individual performing the CPR to give the breaths and give your patient air. Inside of here, these are actually called Tegaderm field. I call them Tegaderm strips, but basically what these are is these are devices that you get, or actually strips that you get when you have an IV, and these are actually placed on, these smaller ones are for your hand, the larger ones are actually placed here in your arm when you receive an IV here. But the reason I put these in my kit is so that if I needed to waterproof a wound, okay, this is going to keep any type of mud, debris, water, out of your actual wound, and give it some time to, stay dry, basically, until you get to a safer place, a cleaner place, more secure place. You get out of the woods, whatever the case may be. You wouldn't want to leave these on for a very long period of time, because they are going to prevent the wound from starting to properly heal. It needs oxygen to heal. So, for example, if I've stitched up a nasty gash on my leg, but I know that I'm going to have to travel miles through the forest, maybe possibly cross rivers, I'll apply one of these on top of that wound to keep everything out so that it doesn't get infected. So that's what I throw those in there for. So again, now I'm actually going to go back to some basic items. Pick these up you can pick these up at your local sporting goods store or Walmart. I've got some Stingies as well as some Smart Free bug spray. It's deep free, which I like the deep free better. These particular items, especially this one, I got because my son, when he gets stung or bitten by mosquitoes, he seems to have a lot worse reaction than the normal person does. So I've got these in here again. This is just an overall around medical kit. Here I've got some military dressing, combat quick clot, which is an absolute must. This basically is going to help that wound, that traumatic wound, and cease the bleeding, okay, and help clog that wound. Now, some medics will say that you can stop the bleeding just as well with applying direct pressure over a period of time. Absolutely true. However, I'd rather have both to be on the safe side, okay? You've got your H&H compressed gauze. You'll find this in most of your basic IFAKs. You'll find this in more of your advanced. This stuff right here can be expensive. You're probably looking at anywhere, I've seen it as cheap as $14 at a gun show, all the way up to $30 for it. So it is very expensive. However, this is an absolute must for your kit. This is where this second compartment here is where I had the Tegaderm strips. In this back compartment, I have a waterproof bag, and I'll empty the contents out real quick and just kind of go through it. Actually, everything here on this back side is just different sizes of gauze depending on the type of injury that I might be facing. And on the back, I have some iodine swabs. Very simply, they're just swabs saturated in iodine. That stuff kills anything. So if you've maybe got a wound that's got a lot of debris, try to clean it out with some water the best that you can and apply some of that. This is my actual suturing kit here. Well, I'm going to go over hemostat, mosquito needles, whichever one you prefer to call it. This particular packet here, We use the same stuff at work, but in a lot larger form. This was given me by a combat medic buddy of mine. This is actually designed for cleaning instruments, medical instruments. This is not used to clean my hands, whatever the case. We have the wipes at work, and this is a germicidal wipe, and it actually irritates my hands really bad. So again, this is not for, it's by a company called PDI, Super Santa Cloth, but it's a germicidal cloth. But again, it's used for cleaning medical devices, and this is what I'm actually going to use to grip inside this suturing kit is my needle, and of course there's a picture of the actual needle itself and thread. And what this is designed to do is this is to grab that needle there and of course loop it through the actual wound site and seal a large wound, a cut, I should say. So that always stays in here, and it stays waterproof. You need to have this in every medical kit that you have. I cannot stress this enough. Imodium AD. This could save your life more times than you would probably think. If you are in a life or death situation, survival, maybe you've just ran out of water and you've decided to go down to the creek, fill your canteen up, start drinking it, and you become sick because of the parasites that live in the water because you didn't clean it or didn't boil the water properly. Boom, now you've got diarrhea. In some severe cases, you can die as little as 48 hours with severe diarrhea. So this Imodium AD could save your life. Here I have generic Benadryl that I keep with me. I do have a reaction to bee stings and do become very sick. So I am on the verge of probably anaphylactic reaction to bee stings. I've been stung so many times in my life. But again, this is the first thing that I'm going to do in a life or death, or not a life or death, but if I become stung by a bee. Now, however, again, I am not telling you that this will work, but in a worst case scenario, there's a lot of information out there, and I have been told by a combat medic instructor that if you triple the dose, this is a single dose, 2 tablets of Benadryl, but if you were to actually triple the dose, this will actually act as a slow-acting EpiPen. Okay, this could save your life, and that's the exact reason why I always carry 6 in here, just to be on the safe side. So again, that's what that is, and here's some more gauze. So that's pretty much this kit here in this compartment. Moving on to the next one. This is a nasal pharyngeal tube. This is administered to keep the airways open through your nose. Okay, small bottle of KY jelly. This is actually what you'd want to do is you'd want to saturate this before you insert it into the nose. You can, in a situation, you could actually lick this thing. However, it's not going to be inserted into your nasal access as easy. So if you've not ever had to actually have one of these administered to your nose, I promise you that you're going to want some type of water based applicator to apply to this in order to help it. However, if your patient is unconscious and you're trying to secure the airway, it's not really going to matter. Get this in as good as you can. Here I carry it's actually prescription eye drops, but the reason I put this in my kit is because that if I was to get a branch in the eye, maybe I've got some kind of bug, whatever the case may be, I can use this as an actual eye wash. Okay, I know that it's designed to go in my eyes. I'm not going to be using water from a stream where I could also contract some other type of bug or whatever the case may be. So that's one of the reasons that I carry this in my particular kit. Here's just a few packets of quick clean my hands out real quick. Here I have two more bottles of betadine. This stuff again is great. You know, iodine is a lot more expensive. This, in my opinion, is just as good at killing just about everything. Okay, you know, killing anything that you don't want in the wound per se. Here The reason I carry this survival wrap or emergency blanket is for if a individual was to be going into shock. If I was to be going into shock, you know, if you've got somebody whose core body temperature is just dropping too rapidly due to wounds because they're going into shock, again, you'd want to wrap them in this blanket and try to bring that core body temperature up the best that you can. And again, this could save somebody's life. Here I have what's called the Israel bandage, which is basically just a very large bandage. There's a lot of videos on this, so I won't go into a whole lot of detail about this. I also have some additional hand sanitizer. Again, I've got some of these things that are you know, repetitious. However, I don't feel like that's a bad thing. You know, if this was to get completely soaking wet from sweat or condensation from my water bladder inside of my bag, you know, I've got a backup too. Inside of here, I've got pain medication. It's not Tylenol. I do have a prescription for. So if you do have any type of medications that you're on a regular basis, you know, you could use them and vacuum seal them or put them in tubes like this to keep with you while you're out in the wilderness. I have a face shield. If I have to administer CPR to somebody, I do not want them vomiting in my mouth, which is a very high possibility when administering CPR. It's one of the reasons that they got them. Also, too, if I come up on a stranger, I don't know that person's medical history. I don't want to take any chances. So I have these, and you can pick these up from any American Red Cross for, I think, $3-4. So an absolute must in my kit. I've got some rolled gauze here, okay, and there's nothing else on the inside of that compartment. In here is an EpiPen. This is what you administer to somebody who maybe they eat some peanuts, maybe they get stung by a bee, whatever the case may be. It's basically adrenaline, and this could save your life, especially if you have bee allergies like myself. So this is an absolute must that I keep in my kit. So there's that item. In this particular last compartment here, there's a lot of different items. I'll go over this last. I always keep chapstick in my kit, as well as sunblock. If you're going to be in the outdoors for a long period of time, especially if it's in summer, if you'll watch any survival video, or, you know, I Shouldn't Be Alive episode, whatever the case may be, any of these individuals that have been out in the wilderness for, you know, multiple days, 5, 6, 7, 11 days, all of them are just severely sunburnt because they had no way to protect themselves. And that's one of the last things you need, is to get 30-degree burns, you know, on your face, and then, you know, they start bleeding, and then it gets infected, and it's usually the little things that can end up killing you. It's a combination of little things. It's rarely just one solid emergency or one solid thing that actually kills you. It's a combination of smaller ones. So I always keep this in my kit. Throughout my kit, I've got migraine medication. I get migraine headaches a lot. Ever since I've came back from the Gulf, I've had them. So I always keep these in my bag, and I've got some more inside this box. Here is an absolute must. If you're, you know, I used to ride dirt bikes for 7 years, and when I would ride, sometimes we'd be as far as 20 miles away from our truck. So if something was to happen and I'm on my way back, if my motorcycle was to break down and I'm walking back and I sprain my ankle or whatever the case may be, you know, this can help get me by until I can actually, you know, I can tighten that around my ankle. And again, I picked this up at Walmart. So, you know, this will help with sprains. I also have a bottle of water purification tablets. I'd prefer to have something else, and I have actually been doing some research on some smaller items that I could put in here that would be more beneficial. I also have another item that I carry with me in all of my bags. I don't have it with me readily available, so I won't go into detail on that. This is something I picked up out of a medical kit. This is actually burn spray. This stuff is absolutely great for burns. I've accidentally got a couple burns, starting a campfire, and this has always been handy. Inside here, I've just got another bag of, towelettes, smaller band-aids, knuckle band-aids. I've also got some triple antibiotic ointment in little packets here. So just the smaller types of items. And at the very bottom of this, I also have a packet of moleskin. Absolute must for hikers. I can't tell you how was actually on the trail, hiking on the AT, and came across a guy. Actually, a guy just came back from Iraq, and his feet was eat up so bad with blisters that he had been on the trail for 2 weeks, and then he finally got to the point that he couldn't make it anymore, and he had to stop at a local hospital in order to let his feet heal enough before he could continue on. So you want to stop them before they get that bad, so that's what this is for. In this plastic kit, you can pick this up in the travel section of Walmart. They're like $1 a piece, this box is, but I kept this because after I removed some of the smaller band-aids and gauze, I stuck it in there. They started selling these at Walmart in their first aid department, actually in their camping section, CellLocks. Now, I don't use CellLocks for larger wounds because there was a lot of reports that was coming out that CellLocks, the granular formula, it's a hemostatic agent, so it helps prevent, it basically helps promote the clotting of the blood. However, there was a lot of soldiers that this was being administered to in the field, and it was stopping the blood loss, and it was saving lives. However, when they got to the hospital, days later or a week later, they would throw blood clots and die. So we were saving them on the battlefield and losing them in the hospital, which was, unacceptable. So the military has kind of went away from this and has went back to has started going with the hemostatic gauze agents versus this. This still does burn, but for smaller gashes, something that you would not want to use your quick clot for, but it's a nasty wound and it's bleeding pretty heavily, this right here would work. This would work fine for it. So for those types of applications, I feel like that this is really good. Inside of here, I go out and I'll spend, I don't care, $10 on a pair of tweezers. These tweezers that come in these medical kits are absolute junk and garbage. When you get it, throw it away. It's not worth anything. Go out, go to the beauty section at Walmart or wherever and buy you a good pair of tweezers. If you're picking out pieces of wood out of a wound or whatever the case may be, you want something that's going to do the job and it's going to do it right. So buy a good pair. Inside of here, I have a sealed surgical blade. Okay, if I need to make an entry of any sort, that's what I'm going to use this for. Inside of here, again, redundancy. We have more iodine or betadine. Got a couple just little band-aids that are left, as well as some more pain medication, more migraine medication, and this is ammonia tablets if somebody's went unconscious to help them revive. So pretty much that completes this kit. I hope that you find at least maybe something in here may be beneficial to you. If you've got any comments, maybe some things that you carry in your kit that you could recommend that you feel like that I've missed. I also do have gloves in here. I just actually went out and bought some new ones and wrapped them. I just don't have them placed in this kit. Of course, I will do that. So just absolute downright negative comments will be deleted. But if you want to leave, some type of feedback, how I can make the kit better, I'm more than welcome to hear your suggestions. So that pretty much concludes this video, and thanks a lot, guys.